Okay, I must thank the audience for being lenient with me. I think I have one comment and one question to answer. Let me start with David's comment about Cuba's soft power diplomacy. Certainly, I think that Cuba's diplomacy in the Caribbean has been extremely successful, and it really is a very good example of a soft power diplomacy model. My question is, on the receiving side, whether Caribbean governments, Caribbean policymakers have really done as much as we could do with the other side of this technical cooperation. For example, a lot of the training in the Cuban, in medicine that people have received in Cuba has to do with setting up cost-effective primary health care systems, community medicine, preventive medicine. I don't see sufficient implementation of those strategies when the trainees return to their home countries. I don't see, I think that to some extent there's a certain amount of complacency in some countries, not in all, in receiving the cooperation and not in utilizing the real lessons from one developing country to another about how to deliver the best possible health care at the cheapest rate. And I think that we still have a lot to do in that sense. Now, the gentleman in the front, how widespread is Cuba's pool of educated people? I can't fully answer your question. I did see a report. There have been 2 reports I've seen recently, speeches or reports from the Ministry of Foreign Affairs in Cuba, speaking about the numbers of doctors that they have trained, both their own nationals and people from developing countries. I do know that their medical training is certified by the World Health Organization. So it has received the stamp of approval from WHO. And there are large numbers. What it seems to me, again, I don't have sufficient information on this. It seems to me that Cuba has been doing quite a bit of experimentation in how to get the most out of limited resources, how to train a lot of paramedics, people who can operate, who can deliver services in far-flung rural areas. I know their nurses, Cuban nurses, I think, receive 3 years of training. One of the comments I have seen by Caribbean nursing associations is that CARICOM nurses receive 5 years of training as opposed to 3 years. But Cuban nurses have been operating very effectively in CARICOM hospitals. And I think that not enough work has been done on really evaluating the impact of Cuba's health professionals in the rest of the region and in seeing what lessons we can learn and what new techniques they have developed in training that we can absorb into our own system. From one, I think Ambassador Hines spoke earlier about the need to learn from the non-Western models of economic success. The need to learn from Indian technology, from Chinese technology. We also need to learn from innovative technological examples in our own region. You know, we tend to take all our lessons from the United States and others when there are probably models which are closer to our own development levels, which could help us quite a lot. I can't tell you how widespread is Cuba's pool of educated people, but I do think Cuba has a significant number of trained nationals. They have been trained either in Cuba or in a variety of other countries, mostly former Eastern countries, who can be globally mobile in a global labor market. I think this is anecdotal from my own visits to Cuba, though, that there are also examples of a lot of people who have fallen out of their education system and who have been finding it very hard to adjust to the economic changes over the last few years. So it's a mixed picture, but I think they, on the whole, their investments in education have paid off well for them.
Okay, I want to endorse what Jessica just said about future attempts at South-South cooperation and looking towards our own neighbor for solutions. David, your cynicism is also emanating from Trinidad as a response to these initiatives and mega farms in particular. Recently someone wrote about can't we set them up ourselves? People have been asking what is going to happen after the Cubans leave, because they're going to be on 3-year contracts. Are they going to be training people to further the process? Or is it going to collapse like CaPRI 1975 Limited, which is our sugar company in Trinidad? We don't know. It is an experiment, and I think our leaders must see some merit in it. And there have been some successes in Cuba, particularly in the arena of organic farming. Cuba actually won the Alternative Nobel Prize, which was being offered by the Swedish Parliament last December for organic farming. And they have made some strides in biotechnology, biofuels, and biopesticides. And I think what our leaders are doing, I'm not playing up to the politicians here, but they are looking for alternative means of dealing with this problem. Like Jessica said, we've been turning to the US and to Europe for solutions in the past. We have opportunities to explore. And I think Cuba's contribution can be in the arena of technical assistance. And that's what they're most looking at. There are many reasons why Cuba has not succeeded fully in its own drive, but there have been some successes. Whether we can benefit from Cuban expertise is still left to be seen, but I think our states are trying to explore this possibility, because we are in a crisis. We are in a food crisis, and desperate times call for desperate measures. With respect to your question on milk or meat as a source of protein, what happened is that the very urgency of the crisis and the food riots that was happening in Trinidad, Haiti, and Guyana led to CARICOM meeting, this Regional Agricultural Investment Forum in June, that's last month. And they themselves are not sure what they're going to do, but they have been discussing the possibility of turning to milk and soy milk as an alternative source of protein. This is very, very new research, especially because of the contemporaneity of the food crisis problem. And I myself am stepping into uncharted waters. I'm going to Cuba on Saturday for about 3 weeks to look at how they are perceiving the initiatives and what they think they can contribute to the Caribbean with these drives that we are attempting. So I hope I can find something there. Thank you.